Okay, this is James with Emergent. I'm here. We're going to talk a little bit about using the Marsden ball for your VT at home exercises. So I'm at the fire department right now, so this is not my normal habitat as far as being inside the clinic. So this would be kind of like they would have at home. Basically, I have the Marsden ball hung to a ceiling. I have it tied off to a chair. Simple thing that they could do at home. At home, I would give them a command strip, and they could just take the command strip and put it to the ceiling and hang their Marsden ball. A lot of the problem is when you have the Marsden ball hanging, a lot of times we're doing binocular activities and eye tracking activities, so we have a lot of free space where it's just moving, the ball's moving, they're hitting and everything else. That's not going to be as easily done at home as it would be inside a clinic. So what we're going to do is show you a way that you can do a triangulation, a localization activity with them where the ball really should not move. It doesn't have to move at all. So we have the ball, it's hanging there in space. First thing, you want them to come up to it, and you want to put the ball to where if their arms are outstretched, if they stretch their arms out, if their arms are elevated to where their eyes are, that's too high. Or if their arms are down where their hips are, that's too low. The arms should, when they're straight out, should come right across the lower part of their chest, okay? So that's where we're actually built to where our arms are level. So we want the ball just right at arms level or just slightly lower than arms level. So they're not reaching up and they're not reaching down, but should be nice and comfortable, should not feel any elevation in the shoulders or any tightness in their lats in the back or sides of their ribs, okay? So once they're at arm's length, shoulder width apart on their feet, you want to make sure that you're seeing them balanced on both feet. If they're off to one side or they're off to another side, or a lot of times you'll see where they'll actually cross their feet, you don't want that. You want them to be nice and stable, both feet on the ground, equal weight distribution on both sides, okay? And then basically you're just going to have them to touch right hand, okay? And then the hand comes back to their hip, and then left hand. Now, if they do this correctly, their ecocenter, where they are in the center of their body, should line up to the center of the ball, and then their eyes, oculocenter, should come to where the ball is, and they should be able to tell right where the ball is in space. If they're having trouble with that space, what's going to happen is they're going to go through the ball, okay? So you see, if I go through the ball moves. What we want to teach is how to touch that ball in space without that ball moving, okay? So again, they're going to go right hand, then they're going to go left hand, okay? Now you can begin to ask them, was that ball where you thought it would be? Did it feel like you had to reach farther than you intended? Or did you get to the ball faster than you thought you would? These are all ways for them to self-assess and to be able to look at it and to know how well they did. If you're working with a child that is at the point where you're not sure if they're suppressing or you're worried about them suppressing, remember, because it's a white Marsden ball, you can always put red-green glasses on them, and then that way you have a suppression check. Can they create luster on that? And so that you know that you're having a good binocular activity. The thing to check out for is if they can get luster, but as soon as they begin to move their hands towards the ball, the ball turns from that orange luster color to red, then you know that that movement is causing suppression. So that's a way that you can check that. You can use the red-green glasses. Sometimes I do, sometimes I don't. It just depends on where that patient is in therapy. Once they've established that they can touch the ball in space and they're not missing it, and you'll see many modifications. Sometimes they'll come from the top or bottom, or then from the top, or they'll come from the side. You want them coming right to the center of the ball, whatever part is right closest to them, okay? Make sure they're not trying to use different fingers or their thumbs or their wrists or anything like that. You just want their pointer fingers. If you can keep this radial arm, or the radial nerve, the thumb up, that's the best that I found, okay, is be able to touch it that way. Now I can load it. I can load it cognitively just by asking them to say the ABCs. So they would say A, B, As they're doing, make sure that the hand that they touched with comes back before the next one comes through. You don't want both hands out here, okay? That's adding too much information through their vestibular system. You want this to be more of eye guidance. So again, they touch C, then the hand comes back, okay? If that ball starts moving a lot, then you know that that cognitive load is really bringing down their ability to know where things are in space. Once they can handle a little bit of a cognitive load, I'll take that out. I never try to load two things at once until they're comfortable with it. I do a vestibular load. So raising the opposite knee. So raise the opposite knee and touch. Raise the opposite knee. So right hand, left knee, left hand, right knee. And on that, also look for that posture change. If they start shifting weight and they start going back and forth, you know that that vestibular input is really important to them for them to feel safe and stable. So you can begin to work in that regard. Once they can do that, then I will add both together. So now they can go A, B, C. So I have that bilateral integration. I got the left going with the right and right going with the left. I have the cognitive load. I'm working it in space and they're keeping contact of where they are versus where the ball is. Once they're comfortable with that, the next thing I'm going to do is move them back. So I'm going to use pencils. I'm going to move them back to where now they're just touching with the edge of the pencil, and I go back through all the stages. So the first thing, make sure that their thumb is on top of the pencil. They're not holding it from the side or holding it in any other way, but the thumb is on the top. And they're still coming from the hips, and they touch, and they touch, and the ball does not move, okay? If they can do that, we go through the same loading. The alphabet, or saying words for the letters, is another way that instead of saying A, they say apple, Baltimore, Charlie. All the different ways that we normally would load something cognitively, we can do it again through this, okay? They got all that. We also can do bilateral. If that gets really difficult, some children will have a balance board at home, or maybe they have a 2x4 and they can take one piece of 2x4, put it on, and put another piece of 2x4 over the top to create a balance board. Those are ways that you can load that. Once we've moved back from the pencils, then we want to move back even farther. In the therapy office, I would use dowels, but at home, if they don't have dowels, you can use brooms, okay? Anything that has a long handle. And again, they're going to come back, and I keep it to where they're touching the floor with one and reaching out with the opposite one. And touch that ball, then it comes back to the floor, and then they reach out and they touch the ball, and comes back to the floor. And again, once they can localize that and they're not going through the ball, okay, they know right where that ball is, then I go back through all the loading procedures. So I go back through alphabet, I go back through alphabet loading with words, I go back through vestibular. So these are a way that you can use the Marsden ball at home. It does not take up a lot of space, but it is very useful for them to know where they are and where that ball is, and then have that activity that you can do. So hope this works, hope that your kids enjoy it or your patients enjoy it, and we'll try to have more videos up soon. Thank you.